Hey, I'm back. So, watch it. Let's just. I thought I'd jump on because, one, it's been a while, and the reason for that is it's been a pretty busy one on my end. And the main reason it's been busy is because I've been part of a surgical team. So, we'll rewind the clock to give a bit of context. So, 3.5 years ago, I jumped into my medical studies. For the first 3 years of that, I was based down in Dunedin, and it was mostly theory. So it was just lectures, labs, a lot of time in the library, learning the stuff, a lot of time in the books, sat a few exams, passed those, and now we're into like the practical phase of this degree, which is pretty cool. We've seen a lot of patients over the last 6 months. We've been learning off the more senior top dog doctors, and yeah, it's been mega. It's quite a privilege to be helping patients in this way. Obviously, there's a bunch more to learn. The degree goes on for another 2.5 years, but for the last few weeks, I've been part of a surgical team. And a lot of people, when I mention that, they say, "What's it like? What'd you see? What'd you do? What'd you learn?" So we saw a bunch of stuff, which is pretty cool. But I'll just go through my thoughts, feelings, and experiences because I've gotten a lot of questions over the last week or so about what it's been like. The first thing about being in the surgical team that I notice is you're part of a team. So you have all levels of knowledge and within that team. So you'll have the consultants, then you'll have the registrars, and they're generally the doctors. They're specializing in general surgery and will eventually become consultants after years of training. And then under them, you have the house officers, and they're the junior doctors on the team. So they've graduated from medical school, but they've been placed in general surgery for a while until their next rotation. And then you have the students. So you have the trainee interns. So that's the people who are in their last year of medical school. And then you have people like myself who are I suppose the most junior on the team. They're still students. There's hardly any responsibility given to us, but we're always being challenged because pretty much every experience that we go into in the hospital is a new one because we're real fresh out of the theory part of our learning. So that sets the scene, and it's pretty cool being in these teams because it's sort of like this apprenticeship model. Everyone is learning off everyone else in the team, and you're bouncing ideas off each other, and just being in the environment, everyone gets better and increases their knowledge. So that's pretty cool. You get to see a lot of patients, even us as students. So generally, some of the jobs that we got to do was we got to see them when they go into the ward. So we were asked to take histories and examine the patient. So the history is pretty much when you go through why they're in hospital. So you it's sort of like an interview. You ask them a bunch of questions about what brought them in, and try and figure out what the timeline is and what happened up to the point when you see them. There's also you take a medical history, so you find out what's been done medically in their life. Have they had prior surgeries? Have they got any conditions or diseases or illnesses that they've had that's been significant? And you try and fill that up as much as possible so that you have an idea of what they've been through in their life. So that's the medical history. Also, you ask about allergies and drugs and anything else that they may have had, any medication that they're on regularly. And then you ask also about their social history, because that can also contribute to some of their illnesses, and also just their support systems in general as they're going through as they're going through the experience. So do they live with a partner? Do they have kids? All the rest of it, stuff like that. What do they do for a job? What do they do for exercise? Do they have a healthy diet? So it's quite holistic what we cover. But you try and get as much information from there as possible, and then from there you roll into an examination. And in general surgery, generally, the team that we were part of a colorectal team. So it's issues to do with the gastrointestinal tract, so pretty much everything to do with food entering the body, and then how it gets digested and absorbed and all the rest of it, and then how it exits the body as well. So generally when they come to us, there's issues that are to do with the abdomen. So you do an abdo exam, it's called. So you go through that and figure out where it's hurting, and we try and feel for different organs and around the abdomen, and from there, that sort of gives us the first picture of what we could be dealing with. So the history and the examination. And then from there, as students, sometimes we had to present to our consultants or to the registrars, so the more senior doctors on the team, and we'd present the patient, and you do this in quite a succinct and structured way so that they get the key points out of it, and get to they get an understanding of what your line of thinking is, and from there they might ask us students what we think is going on. So give a differential. So we might give our top 3 or 5 differential diagnoses of what we think is going on, and then they might ask us what we think we should do next. Sometimes we're wrong, and they'll tell us that because our thinking isn't as sophisticated as theirs, but it really gives us a chance to get thrown in the deep end and really try and sharpen our medical knowledge and thinking, and really hone in on those skills. So that's the first thing. We learn a bunch of stuff because we're chucked in the deep end quite early on. So the other thing about being on a surgical team is it's quite long hours. So generally we had to arrive at the hospital and meet our team at 7:30 a.m. That was so that we could do what's called ward rounds. That's when we'd go visit all our patients with our whole team. And it's pretty much getting an update in the morning of how that patient is doing. Generally someone in the team will have seen that patient the day before, and they'll present that patient to the consultant. So it might not be us students. Generally, it's one of the registrars, and they'll present that patient so that then the consultant has a fair idea of what's going on with each of their patients, or the patients that come under their team, so that then they can come up with a strategic plan. One, the best plan for the patient, but also is to do with allocation of resources and expertise and people who can actually carry out the surgeries. So we do our ward rounds, and then some often there's a handover meeting. So all the teams would come together at 8 a.m. and we'd go to the handover meeting. So it's generally all the senior doctors would sit on one side of the room, and all the junior doctors and students would go the other side of the room, just to try and absorb as much as possible, listen in. And main point of this meeting was to prioritize patients, and because there's limited surgical theaters, there's limited professionals who can carry out all the roles and jobs. So sometimes some theaters would be closed depending on who's working that day and who's available. So you'd go through all the patients that are expecting to have surgery that day and make sure that they're prioritized in the right way. Excuse me. There'd be maybe like 40 people in one room because you have all the surgical teams in there. It's quite a quick meeting, or you go through all those patients in quite quick succession, and then all the teams would go off to their different roles, because some teams weren't actually in theaters for that day. Some of them were on what's called acute, so they manage the patients on the wards rather than going to the theaters. So if we jump over to the theaters, and when I say theaters, I mean surgical theaters, that's where surgeries are done. It's a really unique environment, because obviously there's a lot of rules in a surgical theater, because it needs to be an environment which keeps the patient safe, but also all the staff safe. There's a lot of sharp objects. There's a lot of things that can spread infection. There's a lot of people in one room. So everyone has a role and a role and responsibility, and when everyone's working together like that and everything just runs, it's like a symphony. Everyone's doing their roles, everyone knows what's going on, and it's pretty cool. So as a student, the first time I went into theatre, one of the things I noticed was how many people were actually in the room. So you 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 think that like there might be a surgeon or two, there might be a anaesthetist, and maybe a couple of assistants, but generally there's a minimum, I guess, of around maybe 8 people. Generally, it can change, it can switch and swap, but you generally have around that many people. So there's the anaesthetists, so they're the doctors who need to put the patient to sleep while the surgery is going on, make sure that all their pain is being managed, that all their vitals are being managed, that they're so that's like their rest rate, their heart rate, everything like that. Just make sure the patient is comfortable during the surgery, and that they have the appropriate drugs at the right time to keep them asleep and also to wake them up at the end of it. So there's the anaesthetist, there's the anaesthetic tech. They help the anaesthetist with all the equipment. You'll have the surgeon. You'll generally have a registrar, so that's someone who's helping out the surgeon. Sometimes the consultant or surgeon is away, and if it's a basic surgery, so it's under the registrar, and they know what they're doing because they've done it a few times before. There's sometimes a couple of students, and also a house officer sometimes. So you might have 3 people directly involved with the patient doing the surgery. And then there's about 3 or 4 nurses floating about, and they have different roles. Some of them are admin roles, some of them are passing sterile equipment to the surgeon or the surgical team, so that only sterile equipment is in the sterile zone. So because everything to do with the patient has to be sterile. So just jumping to that sterile point, this is just to reduce the risk of infection, because generally our skin is there to protect us from bugs and bacteria and all the dirt and everything in the outside world. But when you're doing surgery, you don't have that protective mechanism. So the patients are really prone to infection. So it's pretty amazing how many steps there are to make sure that this infection risk is managed. So anyone who wants to or who carries out the surgery needs to go through a process of scrubbing in. So to put it basically, it's a really intense hand wash, and then putting on the surgical gown in order to make sure that you've got a barrier between yourself and the patient. You also put on gloves and the special surgical mask, but that essentially stops anything from the outside world infecting the patient. And it's not perfect, but it's the best measure that we have to stop anything. So you've got to go through this intense washing procedure. So you chuck on your surgical mask, so that looks like a COVID mask as well as a visor, and then you have to do this intense hand washing procedure. So you scrub under your nails with this special instrument, and then after that you have to wash your hands. And it's not just a normal wash, you've got to get into each crease and crevice, and you go around all your fingers, and you go right up to your elbow, right? So you do that on both hands. And then how you wash off that soap and water is you have to let it hit the top of your fingers and really drip down your arm. So you do that on both sides, and then you have to do it again, but you go from the fingers to the middle of the forearm, and then on both sides, and then you do it again just up to the wrist. So from there your hands are sterile, and you can't touch anything, right? Everything is non-sterile to you, and you have to even dry your hands in a certain way. So you pick up the towel from the special kit that's all sterile and laid out for you, and you have to pat your hands down using specific areas of the towel. Then you put the towel away, and you get into your surgical gown, and that's folded up in a special way so that you can get into it and you keep sterile. And then even how you put the gloves on is a special way. You can't just slip them on. You have to fold them up and make sure they're facing the right way and slip them over the sleeve. And you can't put your hand through until the glove is properly on, and then you push your hand through. So there's all these things that you don't think about when you haven't been in these environments. And the first time you do it, you're real slow, and you need some help with it all. But then you get up to speed pretty quickly once you've done it a few times. But even if you're not 100% sure, it's better to call help. For often students like myself, they take longer than the surgeons who have been doing it for years, and then you catch up to the surgeons who are normally have already started the surgery. But then they got us to do quite cool stuff, like in one surgery, I helped with suturing up the patient once the surgery was complete. So that means just sewing up the incisions. Another surgery got to hold the camera inside the abdomen. So yeah, that's called a laparoscopic surgery if they use cameras instead of opening up the abdomen. That way it has, I guess, better health outcomes for the patient because they've got smaller scars and smaller incisions, so they can heal faster. So there was a bunch of stuff that we got to see and do and learn, and because we're chucked in the deep end, we got to learn very quickly some of the ropes. So, and they often the doctors would be asking us students questions just to see where our knowledge was at, but also just to challenge our thinking. And if we didn't know the answer, sometimes they'd ask us to go away and come back the following day with an answer for them. So really intense experience, a huge privilege that we got to be involved in that way, because I know that not a lot of people get to step into these rooms. And it's also a privilege just helping patients and in such a intense time of their lives. We just see a glimpse of it and it's our everyday experience, but for this patient or all of the patients, it's generally a one-off thing, and they're going through a bit of a hard time because they're in hospital. So yeah, that was my experience, or some of my thoughts, and some of what I got to see and do with surgery. Obviously can't compress it all into one video because we had about 8 weeks of surgery, but it's a pretty cool area. All the people who are working in surgery, they're very hardworking people, very intelligent people. They know their stuff. If you're getting taken care of by a surgical team, generally you'll be well taken care of. Surgery isn't a golden pill or anything. It can't fix everything, but know that the doctors that you're in the care of, they know a lot of stuff, and they'll try and give you the best explanation and give you the best treatment possible for your condition. So, or that was my experience when I saw it from the other side when I was part of the team. So yeah, that's all I've got to say for today. Hopefully I can post a little more often because I've been pretty quiet on socials, but yeah, it's been a busy one to say the least. So yeah, that's all. If anyone has questions, shout out, because I'm always happy to share what I've been through. Yeah, I know that not many people get to experience these sort of things. So yeah, that's all from me. Hope everyone's doing well. Enjoy the rest of the week. We'll catch you later. Peace.